Hi, my name is Christine Dubois Matson, and I will be presenting an initiative for the Introduction to Public Health course with instructor Dr. Chenoa Williams at Hassan University. This initiative will strive to reduce healthcare associated infections in adults 65 years or older seeking care at any healthcare facility in Maine through a multiplicity of actions. Thank you for watching. Healthcare associated infections are infections caused by a wide variety of common and unusual bacteria, fungi, and viruses while receiving medical care. The elderly population is particularly vulnerable to healthcare associated infections due to factors like impaired immune system, chronic disease, and frequent healthcare interactions. This concern is not new. For centuries, we've known about healthcare associated infections. In the mid 19th century, Ignaz Semmelweis groundbreaking discovery where he observed higher fevers in laboring mother due to the contaminated hands of medical students. This led to the foundation of infection control practices. For my research, I aim to identify what intervention strategies could be implemented by healthcare professionals, including registered nurses, infection prevention and control staff, environmental services. One study used a mixed methodology of a survey focus group where they discovered that surveillance was not a priority for staff and that staff only reported the infection and antimicrobial reports 75.4% of the time to a committee to be reviewed. Additionally, in a quantitative study out of Trabzon's Turkey is that seniors are 15.1% more likely to acquire a healthcare associated infection than those below the age of 60. Other research showed that using a hydrogen peroxide-based disinfectant to clean surfaces were not very effective with multi-drug resistant organisms, and that a multimodal approach is needed. And the multimodal approach looks at sanitation using 5 key strategies: product and approach, technique, education, training, audit and feedback, and communication. The multimodal approach incorporates new technologies and products in its sanitation procedures. In a cross sectional study on multi drug resistant organisms, they found that including electrostatic spraying, a hydrogen peroxide vapor, or UV lights were much more effective in removing more invisible microbes found in the room after a patient with multi drug resistant organisms has left the room. Healthcare associated infections are a public health issue that affects communities worldwide and has a particular devastating effect on residents throughout our communities here in Maine. This campaign is created to address easy solutions that can have a huge impact on reducing unnecessary deaths in Maine. And if that doesn't persuade you, it will also save us money. They discovered that in 2023, these invisible microbes were the cause of approximately 1.7 million healthcare associated infections, which led to about 99,000 associated deaths in the United States. This resulted in roughly 30 billion in excess costs to the healthcare sector. Money we could have better spent. With 55% of these adverse health outcomes potentially avoidable, the role of stakeholders in improving these outcomes is crucial. In fact, more crucial than ever. So, what I propose is for the state of Maine to embark on an environmentally conscious initiative called the Maine Environmental Conscious Coalition, called MECC. This initiative, driven by the coalition of different healthcare facilities, creates a coalition where stakeholders can share the best ideas and technology. This collective effort with stakeholders at its core can significantly reduce healthcare associated infections across the healthcare facilities in Maine. This coalition, in conjunction with Maine's already existing program, the Healthcare Associated Infection and Antibiotic Resistant Program, known as HIR, program could create a check and balance system for healthcare associated infections throughout Maine healthcare facilities. You see, the HIR program already exists as a public health agency in Maine that collects and analyzes data on healthcare associated infections. The HIR program then responds to any disease surveillance transmission threats that may pop up throughout Maine. Therefore, one organization, Maine Environmental Conscious Coalition, or MECC, aims to create unity and collaboration among healthcare facilities by using innovative technology and input from medical experts. In contrast with the other organization, the HIR program will then test the results. Collectively, they will be looking to reduce the number of healthcare associated infections throughout the state of Maine. So, how does MECC plan to do that? First, through the establishment of the coalition, we will ensure collaboration and uniformity throughout the state. This will be facilitated by introducing a new data system, a crucial component that will provide 100% participation in healthcare associated infection reporting. Then we will move on to standardizing infection control practices across all trial hospitals within the first year. Our goal for the following year is to achieve at least 30% reduction in healthcare associated infections within those facilities and a 95% or better compliance with the new infection prevention measures amongst the staff. After that, we plan to launch the WURK, as in WURK, Healthcare Associated Infection Prevention Initiative, for all healthcare workers in Maine. We set the success metric to educate 70% of Maine's facilities, aiming for a 30% increase in awareness and knowledge for those who have taken the course. Lastly, before we take this initiative public, we will first engage with colleagues and universities throughout Maine to educate 100% of the students entering into the healthcare profession and increase their awareness and knowledge of healthcare associated infections by 50%. This is an extensive initiative with a lot of funding needed for us to save thousands of lives. Therefore, to ensure that this initiative is effective and that our education is current, we will have already done the trial run by mid Maine, and the pilot test that MECC pulled from these few hospitals from both Waldo County and Hancock County. Some of these healthcare facilities received the WURK initiative, but the controlled facilities did not, and they went about business as usual. In this trial study, we evaluated healthcare workers' adherence to the current infection prevention control practices and all incidents of healthcare associated infections. And what the MECC found was that healthcare professionals were washing their hands more often in these hospitals, with the WURK initiative actively going on. In fact, those facilities met their target when being monitored, and those facilities are now running at a 95% compliance with healthcare associated infection protocols. Also, knowledge and skills have increased throughout those facilities, and this goal was easy to accomplish. We just had to have a few classes, and then the staff took it from there. It became quite the buzz conversation starter throughout the facilities that we tested in. And with so many healthcare professionals now interested, they continued to learn more information and discuss healthcare associated infections further with each other, really excelling on their awareness and education of healthcare associated infections. However, the most significant target was to achieve a 30% reduction in healthcare associated infections in patients, and MECC achieved this goal. So, how, you ask, can we save people money? Well, it will require everyone to work together. First, stakeholders like healthcare administrators and public health leaders must manage and reduce the impact of existing infections. This prevention approach ensures that infection control policies are in place and that staff are well trained on the steps for which they are accountable for. For instance, a policy like the 5 moments of hand hygiene, where healthcare providers should be responsible for the cleanliness of their hands, should be implemented. This strategy encompasses a multi layer approach to hand hygiene, including product and approach needed for cleaning, technique, and education and training, audit and feedback, and communication. Other stakeholders include support staff like environmental cleaning services and infection prevention, who can be instrumental in reducing healthcare associated infections in our Maine healthcare system. The collaboration of these two departments is an excellent secondary approach to preventing the further spread of healthcare associated infections throughout the state of Maine. With infection prevention and environmental services working with new technology, sanitation could be more than just wiping hydrogen peroxide based liquid disinfectant on surfaces. Collectively, they could introduce UVC transmission devices, pulsated xenon UV lights, high intensity narrow spectrum lighting, and aerosol or vaporized hydrogen peroxide disinfecting techniques throughout the state of Maine, further reducing healthcare associated infection. Now let's get to our primary stakeholder. The key to making this initiative work: the patient. They are the number one stakeholder and truly hold the key to making this initiative work. We will engage these stakeholders by launching the WURK WURK Healthcare Associated Infection Prevention Initiative throughout all healthcare facilities in Maine. By using the acronym URK WURK, our plan is to educate everyone on some key infection prevention practices. It is crucial that everyone takes part in the initiative, as it is our collective action that we will reduce these numbers across the state. W. Wash hands and hold others accountable for cleaning theirs. U. Use appropriate PPE as required. If you have a cold, mask up. If you're going to be around foreign agents, gown up, glove up appropriately so that you can help reduce the spread of infection. R. Recognize signs of infection, including redness, pain, swelling, fatigue, chills, fever, and organ dysfunction. And this leads me to K. Keep your environment clean, specifically within hospital settings. Be aware of the surfaces that are most commonly spreading these infections and require that those surfaces be cleaned daily. We need to make it standard knowledge that anyone who seeks care at a healthcare facility in Maine knows that it's not only their right to a clean environment to get care, but is their obligation to keep it clean. And I'm not saying that it's up to them to be scrubbing toilets themselves, but they should not be acting like slobs. And if they see something dirty, say something so that it can be addressed promptly. And this accountability to be mindful should extend to all those entering the patient care areas. This includes any visitors, family, friends, but honestly, technicians, CNAs, nurses, providers, they all need to do their part as well. Being complacent of a dirty work environment in a healthcare setting puts their patients at risk. Isn't that non maleficent if the surgeon continues to perform surgery after surgery as he watches the teal dust bunnies grow in size each day and roll down these sterile halls? This is an example of a pamphlet or flyer in a provider's office or waiting room throughout all healthcare facilities. By providing educational information on the topics like the WURK initiative proposal, we are empowering patients to take an active role in their own healthcare. The fact is that educating patients is more likely to engage in discussions with their healthcare provider and make a more informed decision on their own treatment options. The ease and the accessibility of a quick grab and go pamphlet are perfect for allowing patients to read and absorb the information at their own pace without the pressure of feeling rushed. The WURK initiative hopes that by using these pamphlets and posters that we can improve patient education and contribute to better health outcomes. Therefore, if we look back at the 2023 healthcare associated infection statistics stating that in the United States, 99,000 deaths were because of healthcare associated infections. Then, if this initiative was used during that time in 2023 throughout the United States, we could have potentially saved 29,700 lives. And it could have saved us $525 million. Thus, as the human population continues to age at an unprecedented rate, the challenges associated with healthcare associated infections become increasingly urgent. In 1900, only 1% of the Earth's population, that's about approximately 15 million people, were over the age of 65. However, by 1992, this number had increased to about 6%, roughly 342 million people. Currently, our projections for 2050, it is estimated that 20% of our global population will be seniors. That is 2.5 billion people. This demographic shift underscores the necessity of implementing robust infection prevention practices and implementing them fast. Let's face it, this is our future. If we're even lucky enough to make it over the age of 65, we need to address this issue, and we need to do that. Healthcare and public health leaders must prioritize developing and implementing a comprehensive multi-layer approach to healthcare associated infection prevention, which is why the MECC is an instrumental in getting this to work in reducing healthcare associated infections across the state. Much of this approach will help reduce morbidity and mortality rates among the most vulnerable populations in our healthcare system. Focusing on effective healthcare associated infection prevention measures can create significant positive change for all individuals utilizing the Maine healthcare system. Practices like these stop infections and save lives and work. So, to get this initiative to work, we need your support. Thank you for watching. Like and subscribe. 5.